Hi, everyone. Welcome to the Aurora Health Alliance webinar, which we titled Building Trust and Connection, Vaccination, Insights and Partnerships in Action.
So I'm just here to cover the basics, and we'll have some other speakers, I think, to get more in depth on just sort of some measles 101, if it hasn't already entered your milieu, given everything that's going on in the US. Next slide. So measles was something that many people may be aware was considered essentially endemic before 1963. Most people had it when they were a kid. And the good news is once you've had measles, you're basically considered immune. One time with the disease confers lifetime immunity. And there's no animal reservoir, which we care about when trying to figure out, can we prevent disease? It really is just something that passes between humans. After the 1960s, we had a very good licensed vaccine. We have seen across the entire world a dramatic drop in measles with very successful vaccination campaigns in many, many countries. But we are, as you know, while no longer endemic, experiencing in this year and some recent ones greater than normal measles activity for a variety of reasons we can talk about, including, as you may have seen the press release, our 6th case in Colorado as of yesterday. Next slide. So a little bit of overview. Part of why measles is so challenging, despite having a very good vaccine that we'll talk about, is it's just very infectious. It's one of the most infectious diseases we know about. So if somebody is ill, we generally say, and they are around 10 non-immunized individuals, 90% or 9 out of 10 will get measles. It's just a very, very effective disease at spreading. It has a fairly classical clinical presentation, including sort of some of this rash, which tends to start on the top of the head and spread down, as well as a prodrome syndrome, fever, cough, coryza, conjunctivitis, etc. And there are, if there's any clinicians, I know CDC and others have done really good presentations about clinical diagnosis of measles, since while people are seeing it more, some folks may have never seen it in their career. Next slide.
Kaitlin, what's coryza?
Essentially cough.
Cool. Thanks.
And probably something else that Meg could tell you more effectively than me, since I am not a clinician in that respect. So situation overview, this is, as you could tell, already grown, but when Melissa put these slides together in the middle of May, we crossed 1,000 confirmed measles cases nationwide, with the concentration of the outbreak being in Texas among specific communities, and 6 cases now in Colorado, and then also Canada and Mexico. Oh, thank you, Meg. Appreciate it. I knew you. It was like, across in Mexico and Canada also experiencing a significant uptick. Probably like a lot of intersecting reasons for this. One is, while we still overall have not bad vaccination rates, the herd immunity or vaccination level needed to prevent measles spread, because it is so infectious, is somewhere in the area of 95% vaccination rate, plus or minus a little bit. And as we even have slight decreases in that, measles is going to be one of the first things you start to see across the board, versus other things that are slightly less infectious, even if they're preventable by vaccination. So measles is sort of our initial one that we see. And there are more countries than just the US who have vaccine hesitance or other challenges with vaccines, as well as I think many people are aware, during the pandemic, preventive health services across the world really suffered, right? We just saw declining well visits, resource challenges with vaccination campaigns the world over in the last few years as well, which have all sort of contributed to a perfect storm. And increased just travel, right? People travel from one country to another more easily than they ever had, meaning things spread through travel more easily than in previous times. Next slide. So all people suspected of having measles should be reported immediately. And this is really whether or not lab reported data have come back. So many people might sample for measles through a PCR, like a nose swab, or taking a blood test for those kinds of things. But if someone is high suspicion or even medium suspicion of being tested, at this point, public health would like that reported right away. If you know your local public health agency, Aurora, interestingly, right, spans 3 counties, and Colorado divides up its public health jurisdiction by county, not by municipality. You can call them, or CDPHE's central numbers are posted here, and those can be reported at any time to them. Next slide. Okay. Recommended for the current US childhood schedule, 2 doses of MMR vaccine. Standard ages would be at 1 year, and then usually about 4 or 5 before kindergarten entry, though you can do a second dose earlier. And that provides 97% protection. Our MMR vaccine is one of the best we have, really very effective. People are considered immune to measles if they are born prior to 1957, if they have lab tests indicating immunity. So you can draw what's called a titer to see if you have immunity either from previous infection or from vaccination, or documentation of 1 or 2 doses of measles containing vaccine. And whether you need 1 or 2 doses just depends on your age, your occupation, and sometimes other risk factors like whether you are traveling internationally. Next slide. So sort of one of my biggest pitches or messages in this is, because we have so much circulating measles, if you are an adult, you probably have been vaccinated. As I mentioned, our measles vaccination campaigns the world over have really been very successful, but many people don't have that documentation of that vaccination. So there's a great handout that actually, shout out, Adams County Health Department developed in English and Spanish. I've linked it there on our website about how you might go about finding your own vaccination record, or if you are an adult who lacks that, because in the event of now, it would be very helpful if you are going to be contacted this week as someone who is exposed to measles in one of the various places we have had a case. And then it's just easier for EPI, easier for yourself to know you're covered and protected. If you can't find it and you would like to be sure you're protected, there is no issue with ever revaccinating someone as an adult. And under the Affordable Care Act, MMR vaccination should be covered under standard insurance plans. It's a preventive health service, so you can certainly also get a dose, but that is the best way to be prepared at this point. Yeah, thanks, Meg. 1 dose is really quite effective. And especially if you've had one before, then just consider a booster. Andy asks, what is the immunity of a child who is under 5 and has only had 1 dose? That's, yeah, exactly that is a little over 90%. Under current CDC recommendations, if you would like to have a kid who is between the ages of 1 and 4 get their 2nd dose early, it counts for school and they don't have to repeat that dose in the future.
Thanks.
Next slide.
That was for everyone and definitely self-serving. Thanks.
Yeah.
I'm just gonna interject real quick. I just did the QR code on the left, the CO Colorado portal, and it works really well. So, yeah, because I was just sitting here going, geez, I wonder if I've had an MMR recently when I went to grad school. So, it's nice to see all of your vaccinations.
Thanks for that. And I guess I should do, as we're talking about younger kids, between the ages of 6 months and 11 months, so technically too young for a standard vaccine. If a family will be traveling with a young child, either internationally or to an area in the United States having an outbreak, talk to your pediatrician. We would recommend a conversation about whether 1 dose of MMR early is appropriate for your kiddo. It is in some cases, not in others, but it is licensed down to 6 months. We don't standardly administer it that early because the immune response of kids really 9 months and older is better than in younger kids, but certainly something to talk to your pediatrician about if you have any sort of pending travel that can't be avoided. And really, at this point, the recommendation is traveling anywhere internationally can pose a risk due to both flights and just ongoing measles transmission in a multitude of countries around the world. Next slide. So we don't have perfect data for across the whole population because we don't track adults in the same way. But thanks to the modern advent of immunization registries, so in Colorado, CIS, or the Colorado Immunization Information System, and other states have similar, we have really good databases of vaccines. It also prevents anybody from having to repeat doses because your record isn't lost. We've done a great job as a state making sure lots and lots of healthcare providers, public health departments, and everyone and schools can see vaccines across counties, across locations. And in Colorado, schools need to report their vaccination rates for school-required vaccines every year. So the data for the 2024-2025 school year, and I've linked it sort of in tiny print at the bottom, just was published by the Colorado Health Department. And I highlighted Arapahoe County, aggregates to about 92.8% of all data reported demonstrate that kids are fully immunized with MMR for their age. So 1 or 2 doses, depending on, well, that would be 2 doses for kindergarten through 12th grade. So not bad, right? Like from a social norming standpoint, I always want to emphasize like the vast majority of people are vaccinating kiddos. And even some of that, roughly 7% of kiddos there is not people who are vaccine hesitant. They just might have barriers to care. So we could always talk about strategies we're employing to reach them and other clinicians are, but not quite at the 95%, which really helps prevent ongoing transmission when we have active cases. So a little bit of work to do, but not terrible news overall. Next slide. So I work for the Arapahoe County Public Health Immunization Program. We work to support people with low and no cost immunizations, primarily for people who are uninsured or receive Medicaid or Colorado CHP+. We have 2 physical locations with addresses there. We also work to go offsite weekly with various schools and partners. So there's our phone number or an email if you would like to request a mobile clinic if you serve a lot of people in that population. Our goal is really to be a gap service to support providing mostly childhood, but also adult immunizations to folks. And thanks to the beauty of CIS, everything we administer can then be seen by pediatricians, by family care providers, and everyone if, say, we do like a school-based clinic, which is an evidence-based practice to help keep kids up to date. And that is a bunch of our staff next to our current mobile unit, which is fun. Next slide. So just some opportunities for collaboration if people need additional training, discussing scenarios. If you want any assistance getting your record into the Colorado Immunization Registry, we're really very practiced at that, including international records. I think one thing I'll plug is if you work with or have lots in your community who might have had vaccination overseas, but if anyone has a record, we're very good at transcribing international records or lots of other local health departments and can help just ensure histories get in there. There are various formulations of measles vaccine around the world. They don't all have measles, mumps, and rubella, like the version we give in the United States. But the measles component, like there's single antigen components in other countries, provide protection in the case that you are a contact to a measles case. So it can be worth having that history in CIS, even though for school or other occupational health requirements, you would still need to get more doses in the terms of a contact tracing scenario like we're experiencing this week. It's very helpful. And we've started putting those histories even for international students that we serve into CIS. These are some suggestions, these questions from Melissa, who's our epidemiology lead, because if you, any employer, any household, any event has people who are exposed, it's really helpful to be able to get lists of people at events. If you're, depending on the situation or staff or situation, vaccines, titers, to be able to quickly assess who's exposed to a measles case, who's at risk, and who is fine. We assume that they're immune, and they should just do some passive self-monitoring for a few weeks to make sure that there's no measles development. So some questions that she put together. If, unfortunately, you or an employer or anyone else ever had to be part of a contact tracing situation. And I think the end is just some contact information. And I think I saw one question from Rich in the chat. And Rich, I don't know the mortality rate of measles prior to that. I know right now, and this tracks with previous data, the highest risk for measles complications, so hospitalizations or other severe health outcomes, are generally among pregnant women, people who are immune compromised, and kids who are under 5. So if you look at CDC's data tables, for the current outbreak, that's tracking pretty well, that kids 0 to 5 have a hospitalization rate of about 20%, which is sort of obviously why we worry about our little ones, and especially ones under the age of 1 when exposed, because they don't have any immunity necessarily. So we try to always prioritize them in our contact investigations and making sure they can get post-exposure prophylaxis, which I should mention, if someone like a kiddo is exposed and non-immune to measles, within 72 hours, anyone 6 months and older can get an MMR vaccine, and that should help prevent or at least reduce the course of measles. For babies too young to receive the MMR vaccine, there's a product called immune globulin, which is sort of a synthetic, or not synthetic, a blood product that's been sterilized, that helps provide an immediate bolus of antibodies. And so those are both available. That should be given within 6 days after exposure. Yeah, and I think, Mandy, to your question about going about life, really, if you are vaccinated, as we said, it's not 100%, but it's very effective, right? It really is one of our best across the board. And I totally agree with Meg, right? That if you are vaccinated, you should be good to go in most every situation. That's why my call to action is really find your vaccine record, or if you can't find it anywhere and don't feel certain about your vaccination status, get a dose of MMR vaccine that should be covered by your healthcare supplier. If you know uninsured individuals who need support getting access to vaccine, your local public health department can help out, because we have supplies of vaccine for uninsured folks that we can provide at no cost to the individual.
There's a question in the chat. Other than COVID, are there other vaccinations that maybe HHS or the feds are downplaying? Is there any change on the need for basic school age vaccinations? Question mark.
Not that I have heard. So yeah, CDC sets essential recommendations. And last I checked, so the American Committee on or Advisory Committee on Immunization Practices, ACIP, which advises CDC on their officially published recommendations, and that's the website that CDC has. I haven't seen any actual changes happen there, though we're monitoring it. We have some local folks, like last I knew Sean O'Leary, who's with Children's or with UC Health, is on ACIP along with some great other folks who I think probably disagree with some certain recommendations right now. So I think it'll be interesting to see, but I have not heard any others, but Meg or others might have word on what they've heard. But yeah, it's an interesting time to sort of evaluate. I will say for school required vaccines, that is something that the Colorado sets for itself with our state board of health. So those requirements come down at a state level rather than a federal one.
I haven't heard of any changes. I hope not. I mean, I suppose flu might be one, influenza might be one that they downplay, because I think it's going to be challenging to have tests every year, that they're talking about having to have randomized controlled trials, or however that looks. But I haven't heard any changes. Thank goodness.
Thank you so much. Next speaker. Is it Shaya or Shaya? I apologize.
It is Shaya.
Okay. Thank you so much for being here.
All right. Hi, everyone. My name is Shaya Christensen, and I am the Adult Vaccine Framework Coordinator for the Colorado Department of Public Health and Environment's Immunization Branch. And I'm here today to talk. I'm kind of shifting gears from some of the mostly childhood vaccine side of things to adult related vaccines. And I'll be talking about an initiative that we are starting up at CDPHE and how you can hopefully be involved. So one thing, I recognize a few names, but I would love to know who's represented on this call. Would you mind putting your organization name in the chat when you get a chance? And then you can go to the next slide, Joe. So Aurora Health Alliance, of course. So the immunization branch at CDPHE is currently working on an initiative to convene partners in adult vaccination in order to kind of get stakeholder feedback as the state of Colorado maintains and builds out our adult specific vaccine programs in the coming years. And as many people on this call probably know or have experienced, we have a very robust funding mechanism and robust program through Vaccines for Children to provide those under 18 who are uninsured or underinsured with necessary vaccines, but the same isn't necessarily true for adult vaccines. We have some funding, but it's quite limited and a little more haphazard. And then some of those, like Bridge Access Program, helped us bridge some of those gaps during the pandemic. But we're back to kind of our more basic funding programs now. And so we're really looking at, like, in the long term, how are we building out adult vaccine programs at the state? And especially how are we kind of building the base and the infrastructure in order to be ready for, should we receive more funding or should a wider program be built at the federal level? Do we have the base work done on the state level in order to support that? And then also, like, how are we serving adults? How are we able to address those things that don't necessitate that funding during that time in order to, like, better serve adults in our state? So basically, we're looking for stakeholders or partners to join us in this process. And there's a lot of reasons why it is, of course, important to have partner participation in this process. But here are a few key reasons why we would love your participation. So much of the work around adult vaccines is really dependent on the people who work with adult vaccines. So folks like many of you on this call, whether you order vaccine stock from the state, whether you use our IIS systems to track, whether you provide community education on immunization or advocate for populations who are at high risk for vaccine preventable diseases. You all are really the ones doing this work on the ground, and everyone in this call brings valuable perspectives and feedback on these systems, and also expertise that can be shared with others. So we're trying to create a space both for information sharing between the state and partners, as well as between and among partners across the state of Colorado. And then also, I'm sure as many of you experienced, the pandemic created a really special scenario for CDPHE. A lot of connections with community-facing providers and community-based organizations came up out of necessity, and frankly, out of community-based organizations saying, we need closer connections to the state, or we need support doing the work that we're doing. And COVID-19 related funding also helped organizations do important work in community. And I'm sure a lot of people were working under that funding. But so that's all to say the pandemic helped us establish and strengthen connections between CDPHE and partners that not previously worked with the state. And we want to continue to maintain those connections and just see what we can offer each other. And another kind of key reason for convening partners in adult vaccination is that we want to ensure the direction of adult vaccine programs in Colorado accounts for partner needs. So for the needs of your institutions and organizations. And we're really thinking in the long term, improving and building out adult vaccine programs at the state is going to be a decade plus process. So we're not thinking about the next year, not just the next year or the next 4 years. We're really looking forward and trying to improve and build out our adult vaccine programs. And we want to maintain those connections that were made and strengthened during the pandemic in this process. Especially as funding mechanisms related to COVID-19 relief are drying up. We want to ensure that we have open lines of communication between CDPHE and community partners. And we want to ensure that those connections, that the connections and collaboration that we can provide, even if funding is a little bit lean, that those connections and collaboration stay strong. And that's collaboration in thought, in information, and in kind of building out these programs over the next 10 plus years. Yeah, and we really want to ensure that the groundwork for improving and maturing our adult serving vaccine programs on the CDPHE level account for the needs of diverse communities across Colorado. And those are the perspectives that community-facing partners like those on this call and who participate with Aurora Health Alliance bring. You can go to the next slide, Joe. So for a little background on this initiative, when I talk about improving and building out adult vaccine programs at CDPHE, we're following a blueprint that was created by the CDC called the Adult Immunization Framework. And it's essentially a hefty checklist or blueprint or guidelines that the state is using to assess the status of our adult specific vaccine programs and plan for the way that they'll be built out. And again, we're not planning for 1 year or even 4. We're really thinking about the long-term improvement of these programs over a decade plus. And it covers everything from infrastructure, so those immunization information systems that providers use to report and patients use to access their vaccine records, to things like provider education, community outreach, provider training. And on this slide, these are kind of the 6 major themes under which this CDC framework is organized. And if you look at those themes, you can see why feedback and input from community partners who serve diverse communities in Colorado is important. Because bringing in partners, you are familiar with how people interface with provider networks. You're familiar with potentially their health navigation. You can guide us in what data monitoring is important for your work as it relates to vaccines. And you're familiar with the communities, with what your communities are saying about vaccination, what barriers they're facing, what kind of outreach and education would help to address vaccine uptake across the state. And because of that, you can help guide this goal setting at CDPHE. Next slide, please. So what we're hoping to accomplish, the immunization branch just completed a survey of partners in adult immunization to get a preliminary idea of priority areas for these collaborative meetings that we are going to convene. And if you didn't receive that, no worries. That's just the first step in being involved. On Thursday, June 29th, from 10:30 to 11:30 a.m., we're going to have the first meeting of adult vaccine partners along with CDPHE. And in that meeting, we will work on collectively establishing overarching goals for the collaborative and setting priorities for coming meetings. So this is really based in what do we all need as partners and how can we serve, how can we set this up to serve each other? And so if you want to say in creating goals for adult vaccination in Colorado, please contact us to participate. Next slide, please. And if you want to participate, you can fill out a form and you'll be added to our email list for this meeting. And it will, again, be a very participatory meeting to kind of look at and like lay the groundwork for an adult vaccine collaborative moving forward. And I'll put this form in the chat as well. And you might be wondering who we're looking for. We are really thinking about partners in adult vaccination in a very broad sense. So if you are a provider of vaccines to adults, if you work in health education that touches on adult vaccines or vaccine uptake, or if you're looking at vaccines within family systems, I know there's a lot of folks who maybe serve more of the work more with childhood vaccines, but are maybe thinking about how are we also serving caregivers. If you work in healthcare navigation or health literacy, or if you serve a specific community that could benefit from your advocacy for vaccine access or better information with CDPHE, we would love you to join. And I think it's important to note that a lot of us, myself included, who are not previously vaccine-related organizations or aren't primarily healthcare-related organizations, got involved in vaccine advocacy and education during the pandemic. So if that's you and you would like to stay involved, this initiative is also for you. And I say that because I was working for an organization in East Colfax that was like not at all vaccine related during the pandemic, and we got involved in in vaccine clinics. I know a lot of people were like that, and you're really um, the touch points to community that CDPHE needs. And I think it's important for folks like that to stay involved. So I'll put this form in the chat, and let's be in touch and build the future of adult vaccination in Colorado. Thank you. I am seeing some questions. And then, are you working with any Black community collaboration? Sherry, I would love to know who you are thinking of. I have a few folks on my email list from BPUF and a few other organizations, but really the more the merrier. So please, yeah, let me know who you're thinking of, and I would love to reach out.
Thank you so much. And then can we move on to our presenter from Stride?
Thank you, everyone, for having me this afternoon. My name is Meg Tomcho, Margaret Tomcho. I'm a pediatrician, and I'm the medical director at our Stride Del Mar, Hampton Chambers, and the school-based sites. And I'm going to talk today about some successes and challenges of our vaccine administration and education in the clinics. Next slide, please. So vaccines are a regular part of pediatric care. As Kaitlin mentioned in the first presentation, Colorado is about 92% in terms of childhood vaccinations. So not the highest in the country, but not awful. This is the immunization schedule for infants through school-age children. We immunize at well-child checks at regular intervals, but it's never too late to catch up on vaccines if your child is behind, late, or has missed a vaccine. When you look at the list of diseases, it's really miraculous to think that so many of these are so close to being eradicated, if not eradicated. So kudos to vaccines and to science for getting this to happen. Next slide, please. And vaccines don't stop after children start school. Older kiddos and teens need vaccines too. Some of those are boosters, and then others are new vaccines, like not new vaccines, but new to the child, things like HPV and meningitis vaccines. Next slide. At our Stride Community Health Centers, we have a no wrong door approach for vaccinating infants, children, and teens. First, before every visit, the medical assistant is going to review the Colorado Immunization Information System, also known as CIS, so that any vaccine that's due can be offered. Vaccinating at any visit is really important for vaccine catch-up and is really possible. And also we accept walk-ins at any Stride location, even with no appointment. Families can walk in if they need to catch up on the vaccines. And fortunately, thanks to CIS, we're able to see if they've had vaccines at another institution in Colorado or have had their vaccines entered into CIS. We're able to see where they're at. We also have some well child and vaccine events in collaboration with the Cherry Creek School District this summer into the fall to get those kiddos vaccinated before school starts. And I don't have those dates on a slide, but I can certainly pass those along. Next slide, please. So pediatric providers tend to be trusted resources in the community, so our strong recommendations can make a difference for parents who are leery about vaccines. Some of the challenges that we face, I think, are just the extent of misinformation that's out, and then concerns and questions about what's happening and the number of vaccines. And I'll go through some of the common questions that we get and how we respond to that. But multiple studies have shown that presumptive language for the recommendation results in more vaccines being given. So using presumptive language means introducing the topic of vaccine with the assumption that most parents really are going to accept the vaccines. So our medical assistants and our providers really try and use these phrases to help be a little bit more presumptive, more or less, to get the kiddos vaccinated. So instead of saying, "What do you want to do about shots today?" the medical assistant will say, "Your child is due for 3 shots," or things like, "Your child needs the following shots." And that has really been proven to be particularly important for vaccines such as influenza or COVID that aren't required more or less for school. Next slide, please. There's lots of words on this slide. I'm noticing it's pretty small. But parents include their pediatric provider as a source of information to help decide about child's health care. And like I said, most parents vaccinate their kids. But when there is hesitancy, some strategies are on this slide, allowing parents to express concerns that can absolutely increase their willingness to listen to your views about the vaccines. When discussing vaccines in partnership with parents, providing the important information first and making sure the parent understands the information, and we can clarify and reaffirm the beliefs about immunizations and modify misconceptions. It's important to encourage parents. One example would be to think about vaccines as software updates for the cell phone. So a vaccine is like updating your immune system to stay healthy and respond to anything that's in the community, to certain germs. There's a lot of misinformation and disinformation about vaccines, so making sure that we explain the importance of relying on science and recognizing that one study or statistic to undermine a lot of science is really misleading. I think it's important, and we've been successful when we explain and are honest about what's known and then what's not known, and giving out information like the vaccine information forms that we have to give out, or at least offer for parents before we give the vaccines, educational resources, and some websites, so that people feel confident in what they're doing with their children. And then really focusing on the positive around vaccines being one of the most significant scientific achievements. And there's such a collective benefit, not just individual, that the whole community will benefit. And then stressing the positives around lives being saved, as opposed to the number of deaths from not immunizing. Next slide, please. So one of my favorite communication strategies to be successful is a truth sandwich. And this strategy applies in lots of situations beyond just vaccine hesitancy. In a truth sandwich, the bread is the positive and the center can be the misinformation. And I think in this, for particular vaccines, things like the MMR, we can talk about how everyone wants kiddos to be safe, that misleading or misinformation is really not okay. There's a secondary gain for that. That's not in the community's interest. And instead, let's support positive communities by vaccinating children. Next slide. So next, again, lots of words. I'm sorry, this is so small. I'm going to talk about some of the common questions we get about childhood vaccines, and then provide some evidence-based yet simple answers that can be used to address the concerns. These are questions that we hear all the time and can challenge a provider in a short time, can challenge anyone that's encouraging people to get vaccines, but I think can be powerful in terms of our explanations. Questions that we hear often are, can multiple vaccines overload the immune system? And really, that's not the case. Babies get lots of different vaccines with small numbers of antigens that help them build their immune system, to help make their immune system ready to fight off whatever it is that it faces. And these are just a small amount of the possible antigens that babies are going to encounter. So no, multiple vaccines won't overload the immune system. The baby's immune systems are ready to go to work. If a child is sick, is it okay for them to get shots? And obviously understanding what's going on with the illness, but generally speaking, children can get vaccinated, even if they have a mild illness like a cold, even a mild fever, or any kind of viral symptoms. It is okay to get the vaccines. Is there a link between vaccines and autism? And this is a big topic, I feel like, in the news, but the answer is definitely not. Autism is a mysterious disorder, and we all want to find out why, but vaccines, there have been multiple studies to show that vaccines do not cause autism, particularly the MMR. Next slide, please. And some other questions. Why do we start vaccines so early? We start them early because, as mentioned earlier in one of the presentations, Children can have some pretty significant morbidity with the diseases that we vaccinate against. And so making sure that we're getting kids when they're younger and when the likelihood of being exposed could cause some serious complications. So that's why we start early. And there are so many doses because we're giving them a small amount of the antigen to allow their body to fight and build up enough immunity and then to boost immunity that fades over time. The side effects of the vaccines are a common question that we'll see in a clinical setting. And I think this particularly we need to be honest about that most children will cry. Many will have some discomfort. Some may even have some low-grade fever, but these are definitely treatable and typically last about a day. And Tylenol and ibuprofen are more than adequate to help this. And I feel like when we're honest about the side effects, parents won't be as concerned if their babies or if their children are having a fussier reaction later on in the day. This is something that happens, but in the long run, the safety for being vaccinated is so much outweighs that uncomfortable day. Next slide, please. So one of the biggest successes we've had at Stride has been the participation in the KITE project, the Kindergarten Immunization Training and Engagement project. This is a project actually from the University of Colorado, so not at all mine. And I only put it here because it was just a very rewarding process to go through the rapid boot camp translation, where we worked with partners, Arapahoe County Public Health being one of them, around developing effective messages. And I think if these projects similar to this are available, that they're very worthwhile and can be very successful for an organization to get messaging that can be meaningful and resonate with diverse communities. Next slide, please. So our group participated with, like I mentioned, Arapahoe County and then also Boulder County Public Health and some families. And we met weekly to talk about vaccine messaging and to create a project for distribution that'll be ready soon. And it was critical because it did bring together the diverse partners to create this child and family friendly messaging. One of the biggest lessons that I got from participating in this was the importance of the strong recommendation. And one of the parents said that her child's pediatrician would say every year, your daughter's due for the flu vaccine today, rather than asking the question. And she felt like when the medical provider said, your daughter's due for this vaccine, it really gave them the confidence that that was something that the provider believed in and wanted to have happen for the child rather than asking, where in her opinion, just one person's opinion, but she felt like it introduced doubt if you asked, do you want this vaccine? So that was just one message that resonated with me for participating in the project. Next slide, please. But to wrap up, we're always medical providers at Stride are always open to questions and conversations about vaccines. We want to decrease as many barriers as possible to keeping vaccines up to date and to keep our community safe. Next slide, please. So this is my contact information and thank you.
Thank you so much, Meg.
Yeah.
I have a question. Do you, as a provider, I know that you shared many sample questions that you get, but do you experience people having, especially in our Aurora communities, having historical, like cultural mistrust of vaccines? And do you have any talking points for that?
That is a great question. And honestly, I feel like we've had a lot of people now with hearing about the measles on the news coming in and asking for measles vaccines that spans language and cultural backgrounds. So that's been, I feel like that's a win because people aren't falling as much for the misinformation. They're wanting their child to be vaccinated. And if they don't know or don't remember that they received the vaccine, they want proof of it. I have had some people ask a lot of detail around what is in the vaccine, particularly around preservatives, but I feel like I haven't heard about from a specific country or a specific part of the world or from a specific part of this country where there's been a bad experience. So I think we're lucky in that respect.
Thank you.
Yeah.
I have heard that Stride is trialing the no appointment time. Is that happening in any of the Aurora communities, and when?
Yeah.
Even though you can walk in and get vaccine.
Yes. So at Peoria, at our large site in Peoria, we in July will be transitioning to a no appointment for probably 60% or even more of for appointments. So people can just walk in, not requiring an appointment. At my clinic at the Delmar site and then the Hampton Chambers, we haven't transitioned and aren't doing that yet. But we'll accept walk-ins for vaccines or really any concerns. But the Peoria clinic is trialing that no appointments at all in the summer in July.
Yeah, if I may, Megan, in the train of thought that I'm following there and Shay and I are discussing, when people come in and they're uninsurable, in other words, we're talking basically about undocumented folks,
Right.
and they need vaccinations and they can't afford them because they're very expensive without Medicaid or without insurance. Are you able to, a 317 or some other program to provide vaccination without the high cost in Stride?
Yes, as a federally qualified health centers, for children, we participate in the VFC or the Vaccines for Children program. So those vaccines are no cost if you are uninsured, underinsured, or on Medicaid. That's for children 18 and under. For adults, we have that program, the 317 program. So that is at lower cost. But yes, you're right, vaccines are expensive. And so I think those programs and any other like grant programs that are available will participate in. But for now, the 317 and then the Vaccines for Children program is available.
Thank you for that, elaborating on that, especially for the adults. We know the kids are covered, at least
Yeah.
right now, but the adults, we're really concerned about them for the future.
100%, yes.
Thank you.
I also just wanted to pop in and answer, kind of give light to the discussion that Rich and I are having in the chat. And thanks for those questions, Rich. I'm not trying to avoid these questions, but we are all, I think like we are all in a position where, and like at the state, we are waiting still to hear back about certain funding sources that affect the 317 program. And so just to be clear, like at this moment, is 317 and like state vaccine stock for adults totally under threat? No. But are those budgets potentially going to look leaner in the next year? And what will that look like? We don't totally know yet. And that affects both the state and then partners and then people referring, right? So, yeah, I hope that we have like more answers in the next month or so. But currently, I think a lot of those, just like what exactly that landscape looks like in this moment is unclear.
Right. Sure. I appreciate that, Shaya. Thanks you so much.
Stay safe out there this summer. Thank you so much for joining.
Yes, thank you, Kaitlin, Shaya, and Meg for presenting. Thank you all so much.
Thank you.
Thanks, everyone.